Thank you all for being here. My name is Andrea Helton, and I'm one of the two new acupuncture clinicians here at the Brown Cancer Center. So acupuncture is used to treat a variety of symptoms associated with cancer and cancer treatment. So the goal today is to help you guys better understand this therapy and its benefits for patients who are currently undergoing cancer therapies and those who are also post-treatment. So as I said, there's two acupuncture clinicians at Brown Cancer Center now, myself and then my husband and partner, Dr. Colby Helton, and we've both been in practice for about a decade. So today's objectives are to acquire knowledge about the background, training, and scope of licensed acupuncture clinicians, increase literacy in acupuncture research pertaining to both outcomes and biological correlates, and then gain an understanding of acupuncture as a supportive therapy and oncology and the best practices for integration. So first, you'll notice that throughout this presentation, I'm going to use the term integrative instead of CAM, which is complementary and alternative medicine, and I just wanted to take a quick moment to explain why. Because especially in the oncology field, the mention of CAM therapies can sometimes fill physicians with a bit of dread, which is understandable. So for a long time, CAM was the standard term for any modality that was outside of mainstream medicine. Complementary meaning in addition to, and alternative meaning instead of conventional care, with or without physician's knowledge, which is problematic. CAM is also a kind of nebulous term that doesn't really distinguish between therapies that are evidence-based and those that are ineffective or in some cases even harmful. Integrative health, on the other hand, means bringing safe and evidence-based therapies together in a mutually supportive way. So you have multidisciplinary care teams who are collaborating to design treatment plans that emphasize whole person, accessible, and equitable healthcare. I also want to clarify how we categorize acupuncture. So acupuncture is the primary therapy from a whole system of medicine called traditional Chinese medicine, or TCM. TCM is classified as a traditional medicine, which means that it's a form of healthcare from a different culture that predates modern medicine. So TCM is a long-established whole health medical system for the diagnosis, treatment, and prevention of disease. In addition to acupuncture, it includes herbal medicine, body work, dietetics, different movement therapies, and just kind of general health and life guidance. It's estimated to be between about 4,000 and 8,000 years old, and it has spread worldwide while maintaining a really strong foothold in China. In fact, TCM is central to the Chinese healthcare system, as modern medicine and TCM are practiced alongside each other in both hospital and primary care facilities. So today, the challenge is how do we best integrate TCM into Western healthcare systems? So the main point that I want to drive home today is that acupuncture and TCM are not in conflict with modern medicine. It's just a different way of looking at health and disease, and it can be a really valuable supportive therapy for cancer survivors, namely because it is safe and regulated, evidence-based, and very easily integrated. So first and foremost, the importance of acupuncture safety can't be understated. And today, the general consensus is that acupuncture is safe when it's provided by a licensed acupuncture clinician, or LAC. As with any therapy, there are adverse events and reactions that are possible, but all of these are very rare and transient. So of these rare possibilities, the most common ones are minor pain, bruising, or bleeding, and then sometimes temporary nausea or lightheadedness after a treatment. Very, very rarely we'll see a temporary exacerbation of symptoms, but then issues like nerve or vascular damage, infection, and organ puncture are incredibly rare. So we are specifically trained to avoid this. And unfortunately, when you read about these events happening, it's most often because the provider was not an LAC. And this is really why training matters. So speaking of training, acupuncture clinicians go through really intense education, and our field is thoroughly regulated at the federal level. So it begins with a supercharged master's degree that takes about 4 to 5 years to complete if you have a bachelor's degree already. So it starts with about 3,500 hours of didactic, and it covers both TCM and biomedicine. So on the TCM side, we learn kind of basic theory, herbalism, dietetics, but then most intensely, acupuncture point location, function, and technique. And then all of this is combined into case conceptualizations in our later years. And then, of course, safety and ethics. On the biomedical side, we learn medical terminology, anatomy, physiology, which for me included intense couple years of cadaver lab, general and systemic pathology, basic physical exam, pharmacology, and then what's called the clinical medicine series that covers the etiologies, pathophysiology, signs, symptoms, and treatments of common conditions. So the purpose of these courses is to help us work in integrative settings, to collaborate with physicians, and then most importantly, to catch red flag patients so we can properly refer them to appropriate care. So just to kind of segue, I'll never forget working with a patient. She actually came to me several years ago for low back pain and constipation, and she was just released from care from a pain clinic because they thought she was opioid seeking. But because my training, again, teaches me to look at this whole person, we decided to do a whole health history review of systems and just a really basic physical exam. After a few minutes of abdominal percussion and palpation, I felt what was, to me, felt like a very large mass, just medial to her abdominal aorta. So obviously not in my scope to provide a diagnosis at all, but I did tell her the exam felt abnormal and then proceeded with an immediate referral to urgent care. And then about a week later, I received a call from her that imaging had revealed a large tumor that was located between her aorta and her spine. So thankfully, she is alive today. She's on maintenance care. And this is just a really great example of why our biomedical training is so important. We're not here to replace or pretend that we're physicians, but it really helps us get people to where they need to be. We also complete about a 3-year clinical residency, which is done alongside our coursework, where we work with patients in clinic and then participate in case presentations. And then after completing our master's, we do 4 board examinations, and then we can apply for licensure. So here in Kentucky, we're licensed under the medical board as allied health professionals, and then maintained it through continuing education. And then for some of us, like Dr. Colby, the master's degree is not enough, so you can return to school for an additional 2 years of coursework, clinic hours, and then a capstone project to obtain a doctorate. So getting into the theory and evidence, in the past few decades, we've seen an explosion in acupuncture research, including RCTs, reviews, and analyses. So in addition to expanding outcome research, recent research is also focused on identifying the biological correlates of acupuncture, so really trying to elucidate how it works. So today, it's really no longer a question of whether or not it works. It's a question of how it works, and then how do we properly integrate it. And so how to understand how it works and how to properly integrate it, you really have to start with learning some of the foundational theories on which it's based. So the next couple of slides are just going to involve a quick comparative look at TCM theory with modern medicine. So as previously stated, TCM, it's a whole health system for the diagnosis and treatment and prevention of disease, but it's built upon a foundation of very unique terminology and theory. So the theory and terminology may sound a bit odd, maybe even sound mystical to modern medicine. So it's really important that you remember cultural context when discussing and thinking TCM. So specifically that TCM evolved from an ancient culture that uses metaphor and naturalistic symbolism to convey complex theories and processes. So my hope that seeing the TCM terminology presented within this context will help you associate it with tradition, not mysticism. So when you hear terms like yin and yang, the important thing to remember again is that these are not mystical terms. They are just abstract concepts that are used to describe the features, relationships, and cycles expressed in nature and biologically in our own bodies. So these concepts also reflect that their inherent interconnection of all things, that the entirety of nature influences us and we it, and then internally all of our biological systems exert influences on each other as well. So one way yin and yang theory can express itself in modern medicine is through the dynamic relationship between the sympathetic and parasympathetic nervous systems as they share a mutually balancing relationship. And then the kind of interconnection aspect of this yin and yang TCM theory expresses itself biologically too, through the complex web of triggers and etiologies of disease, or the symbiotic relationship we share with our microbiome and how dysbiosis can contribute to a whole myriad of systemic issues. And TCM theory also has its own terminology for our body's biological and psychological components. So again, keeping cultural context in mind, you can just think of these as traditional terms that were used to describe anatomy, physiology, genetics, aging, and consciousness. But I do want to take a brief moment to discuss this concept of qi, as it's one of the most central concepts in the practice of acupuncture, but has really vast misconceptions in Western society. So qi is often translated as vital force or energy, but this translation, as it's understood and used in Western cultural context, isn't really accurate. So TCM first became popularized in the United States in the 60s and 70s, a time when the term energy was associated with the New Age movement. And so this resulted in qi becoming kind of a metaphysical, esoteric term. And sadly, this is often what happens when Western society adopts or appropriates a traditional medicine. And it reminds us why it's really important to preserve the cultural components of traditional medicines. So to properly understand qi within cultural context, we first need to understand that the Chinese utilized a pictographic written language, meaning that the characters are symbols that represent objects related to the words they represent. So the pictogram for qi, which is here on the slide, it's technically two symbols. It's the symbol for air set over the character for rice. And so collectively, it depicts the steam that rises from cooked rice. And so this indicates to us that qi is a vital active process, not a physical mystical substance. So a more modern way of looking at qi is to consider it a kind of clinical shorthand that refers to our collective vital physiology. So qi can therefore refer to a multitude of processes, the production of ATP or neuroendocrine or immune responses, body movement, gut motility, tissue remodeling, respiration, circulation, and more. So keeping this in mind, let's get into acupuncture points. So according to TCM theory, acupuncture points are specific areas where qi, physiology, can be influenced. Points have specific functions and indications, exuding effects both locally and systemically. Acupuncture points themselves are located along meridians or pathways, which have very specific and directional courses through the internal viscera. And as you can see on the picture here, the meridian system kind of looks like any other biological system, and yet no system is completely and singularly linked with meridians. So it's not our nervous system, it's not our circulatory system. So what are they exactly? And this really leads into new research and these discussions about the biological correlates of acupuncture. So today, the general consensus is that the many effects of acupuncture can't be explained by a single mechanism. Instead, acupuncture is thought to create various impulses that interface with the nervous system, leading to a vast array of biological reactions. And it really does seem to depend on the specific acupuncture points being stimulated. So some of the first theories about acupuncture were gate control and endorphin theory, which was that acupuncture stimulates pain inhibitory fibers to block pain signals, and then causes the release of endorphins and other endogenous opioids, resulting in kind of a systemic feeling of comfort and decreased pain. And then came local mechanotransduction theory, which is that acupuncture creates a microtrauma, which then transmits a mechanical signal through connective tissue, which then leads to a cascade of self-healing processes, such as tissue remodeling and pain modulation. Now, neurohumoral theory, which is supported by research, builds on these previous theories, but is far more comprehensive. And essentially, it states that acupuncture points themselves are areas of high microneurovascular concentration, and that acupuncture itself causes an immediate release of ATP, which then triggers sensory nerves to send impulses up the ganglion, through the spinal cord, and then into the brain, specifically interfacing with the limbic system, but also the somatosensory and the prefrontal cortex. And then these impulses then connect with interneurons to either facilitate or inhibit various functions, such as pain blocking, releasing endorphins, releasing certain neurotransmitters, decreasing inflammation, increasing circulation, and promoting tissue healing. And then these impulses also exert regulatory influences on our body systems, namely to rebalance the sympathetic and parasympathetic nervous systems to restore homeostasis and help people out of sympathetic dominance. And this is primarily done by stimulating vagal nerve activity. So this neurohumoral theory explains a lot about the observable benefits of acupuncture, but it still doesn't really explain point specificity or what meridians are. In other words, it can't explain why acupuncture point stomach 36 on the leg can calm cytokine storms, or why large intestine 4 on the hand can stimulate bowel movements and alleviate pain, or why pericardium 6 on the wrist, can calm palpitations and nausea. So one relatively new and still theoretical possibility is known as morphogenetic growth control theory, which was pioneered by a man named Dr. Charles Chang, who's a physician, professor, and researcher with background in biochemistry. This theory suggests that the meridian system is actually related to the bioelectric field involved in morphogenesis and growth control. Specifically, that acupuncture points and meridians may be leftover remnants from organizer cells and boundaries, which are the groups of cells that have the ability to instruct morphogenesis cell differentiation, kind of steering their development into specific organs and tissues. So he's very readily accessible if you want to reach out to him and pick his brain more about this theory. It's very interesting. So before we get into what it treats, I want to point out a few things to keep in mind if you decide to do your own lit reviews about acupuncture. So personally, I come from a family of physicians. I went to a research university. I've worked in multiple labs. I really recognize the importance of research, but research in acupuncture and TCM is a bit challenging for several reasons. When you look at individual studies for acupuncture, including RCTs, you will almost always see significant improvement in the treatment group compared to the control group. But when evaluated in meta-analysis or systematic review, the strength of evidence is often considered weak, and this is due to several reasons. First and foremost is funding. Funding remains the biggest hurdle when it comes to evaluating strength of evidence, as many individual studies only receive enough funding for small sample sizes. And this ultimately leads to lower evidence strength. So to improve quality and strength, obviously we need more funding for larger scale studies. And second, gold standard of most research fields is to isolate and control as many variables as possible, so you can elucidate single variable, single cause. But as we've learned, this is not how TCM works. TCM is based on holism, and its effectiveness depends on a multimodal implementation of different therapies. The therapeutic relationship is also paramount in the treatment process, as feelings of trust and empathy and communication are important to whole health. So you can't really completely apply reductionist methodology to it. All of these variables matter and exist in this kind of web of interrelationship. Third is blinding. So blinding is next to impossible. There is no such thing as a biologically inert placebo for acupuncture. There is something called sham acupuncture, which is performed in certain studies, but it's very poorly defined and inconsistently implemented, and it's also not biologically inert. It's actually no longer recommended by the NIH. But some reviews and analyses will still dock points for a lack of placebo, even if the study still has a random controlled group. So fourth, acupuncture also requires the ability of the clinician to properly diagnose and skillfully treat people based on their symptom presentation and their constitution, meaning that an individualized approach by someone with expert level technique is important. So standardized acupuncture protocols may be important for research, but they're not often wholly applicable in real life settings. That all being said, despite some of these research challenges and funding difficulties, acupuncture literature has still exploded in recent years. We know that acupuncture is safe. We know that there is a surplus of outcome research showing benefits for a wide variety of conditions, and we do have scientific theories that explain its mechanics. But ultimately, what we really need is our own gold standard research methodology and adequate funding to improve our strength of evidence. So, what can it treat? Various organizations around the world have compiled comparative lit reviews to look at this in depth, and here are some of the conditions with the most research support around the world. So looking at this, you can see the potential benefit for cancer survivors, whether we're trying to help with cancer-related symptoms or with other conditions that they're dealing with. Acupuncture and TCM also has endorsements from multiple major organizations, many of which have already integrated acupuncture into their platforms. And as you can see, there's also growing insurance coverage, including Medicare and Medicaid. So to date, acupuncture also has a very strong presence in academia, and these are just a portion of the institutions that are currently researching and offering acupuncture in their institutions. And then acupuncture has been integrated into many established oncology centers, and obviously we're really glad to be offering it now at Brown Cancer Center. So now let's get into how acupuncture can actually integrate into oncology. So we all know that safe and effective therapies are needed to improve our patients' symptom burden and also improve their quality of life. So in 2016, the National Cancer Institute held an expert panel on the safety of acupuncture for cancer symptom management. The panel concluded that acupuncture was safe for cancer survivors, especially when the acupuncture clinician is in-house under the same roof as the oncology team. The evidence currently available has suggested that acupuncture is a safe and effective therapy during cancer to address some of the symptoms of cancer, alleviate the side effects of certain cancer therapies, improve comfort and quality of life, and allow patients to actively participate in their care, and then address co-occurring conditions. So specifically, we're going to discuss the following conditions as they relate to acupuncture: chronic pain, neuropathy, nausea, vomiting, xerostomia, leukopenia, hot flashes, insomnia, fatigue, lymphedema, comfort, and then comorbidities. So cancer pain occurs throughout different stages of the cancer journey, even long after the initial diagnosis and treatments. And studies have shown that acupuncture's role in the management of cancer pain is pretty vast. So multiple reviews have concluded that acupuncture is effective in relieving cancer-related pain and postoperative pain. Acupuncture can be used alone for mild to moderate pain and in conjunction with pain meds for severe pain to improve their effectiveness, reduce the need for high dosing, and to reduce the side effects of pain meds. And then just recently, the American Society of Clinical Oncology released a special article which provided updated recommendations regarding integrative approaches to cancer pain, citing acupuncture should be recommended for numerous cancer pain-related conditions. So as you can see, acupuncture is considered an evidence-based and consensus-driven therapy for a variety of cancer-related pain conditions, including aromatase inhibitor-related joint pain, general cancer pain, and postoperative pain. I'm skipping CIPN now because we're going to get to that next. And of course, as you can also see, the evidence quality, again, ranges from low to intermediate, and the strength of evidence is also weak to moderate. And this is when we have to go back and remember our research considerations when it comes to funding and design methodology. The individual studies that were reviewed by this panel all showed positive, significant results, but the sample sizes were a little small, and again, there was inconsistent use of blinding and sham acupuncture. Nevertheless, even in the case of low and weak evidence, the consensus was still that acupuncture should be recommended for these types of pain, as the potential benefit far outweighs the potential risk. And individual acupuncture studies consistently show positive effects for pain management. So in total, the management of cancer pain requires an interdisciplinary approach that includes pharmacologic treatments and non-pharmacologic options. In some cases, acupuncture can be used alone to achieve a satisfactory result, but it really depends on clinical judgment and then especially patient preferences. So now looking at chemotherapy-induced neuropathy, or CIPN. So we know that it's often a temporary condition, but it can still take months or years to recover, and it can be really debilitating for a lot of our patients. So acupuncture can be very helpful in shortening that recovery time or making the recovery period far more tolerable, or in some cases eliminating the neuropathy altogether quite quickly. So multiple studies have shown that frequent and regular, that's the two key parts, frequent and regular acupuncture is significantly beneficial, even long-term, for CIPN by alleviating pain and reducing the reliance on medications, improving touch perception, improving nerve conduction for both sensory and motor nerves, and it may even accelerate nerve regeneration. Now, clinically speaking, this is the #1 complaint we're currently seeing from patients at BCC, and it's probably one of the conditions that we actually see the quickest response to, providing we can get them in on a regular basis. Now looking at digestive issues, so even back in 1998, the NIH stated that there was clear evidence that acupuncture was beneficial for cancer-related nausea and vomiting. And this has been reinforced with continuing studies over the last 20 years. So like with pain, acupuncture can be used alone or in combination with medications. Though some studies do show acupuncture yielding comparative results to certain antiemetics, but without the side effects. So it makes it a great option for patients who do want to reduce their overall pharmaceutical load. Specifically, acupuncture is effective for reducing the incidence of CINV when it's used after infusions. It can reduce adverse effects of antiemetics while improving their effectiveness, or it can actually be used prophylactically if they want to come in before an infusion. And this is especially important for patients that deal with delayed CINV. And then just like the management of pain, it's really going to come down to clinical judgment of the oncologist and the patient as to whether or not they want to try acupuncture in conjunction with antiemetics to increase their efficiency and reduce side effects, or they wish to try acupuncture alone to reduce their pharmaceutical load. So obviously I am not anti-pharmaceuticals at all. I really believe, again, in this integrative, multidisciplinary approach where we're all working together to make the best judgment calls for our patients, and then obviously listening to them and seeing what they want to do as well. So clinically speaking, Colby and I have also seen really significant and quick improvement with nausea with our patients at BCC. And this is especially when they can come in prior to a chemo infusion. We have a lot of patients that actually try to come in like right before they go upstairs. And it's really nice to see them come down and not feel so awful right after. So for patients who are on kind of oral therapy, we also recommend kind of coming in regularly just to reinforce the benefits. So xerostomia is another very frustrating side effect that can last for months, even years post-treatment. However, several studies have shown that acupuncture can help alleviate the dryness and improve salivary function, again, even for long periods of time, up to 2 years. So this was most notably demonstrated in a study that showed that the unilateral stimulation of large intestine 2 on the hand was associated with bilateral activation of 2 areas of the brain related to salivation, and this was measured by MRI. Saliva production was also measured, and the results correlated with the neuroimaging findings. So it was a really interesting study to read. Clinically speaking, Colby and I have only had a couple of patients with this, but we're really excited to share more comprehensive results later on. So leukopenia is a particularly interesting area of research as we need to be very delicate with our clinical approach. On one hand, studies have shown that acupuncture has a positive effect on white blood cell count, as well as the potential reduction in marrow suppression, which is observed in blood draws after acupuncture treatments. But on the other hand, as we know, patients who are immune compromised are at a higher risk of infection and bleeding. So that being said, acupuncture clinicians we're specifically trained to be considerate of vulnerable populations. This is why we have to go through the intense coursework that we do, especially regarding clean needle practices and gentle technique. In addition to the needles all being single-use and sterile, we also are always ensuring that our working station is sanitary, that our hands are always sanitized, wiping down our patients with rubbing alcohol, just like venipuncture. Acupuncture needles are also very small. They're solid, filiform 40-gauge needles, so just a little bit bigger than a cat whisker. And we also learn specific techniques for our patients who are on blood thinners or who are otherwise at risk for bleeding. So again, it's very important here for clinicians and organizations to utilize their clinical judgment to ascertain the safety of acupuncture for an immune-compromised patient. At Brown, it's recommended that their ANC is above 1,000 and their platelet is above 50,000. So moving on to hot flashes. So again, numerous reports suggest that acupuncture is beneficial for reducing hot flashes of various etiologies. And several of those studies demonstrate that acupuncture's ability to reduce hot flashes related to cancer, again, even for long periods of time. So we're seeing durable results for a lot of these conditions. So similar to the ASCO guidelines, when it comes to looking at systematic reviews and meta-analyses for acupuncture, the results will kind of vary. And then again, having to go back to some of those research challenges and considerations. That being said, it's still recommended for cancer-related hot flashes based on the benefit to harm principle and then just general clinical consensus. Looking at insomnia, there is ample evidence suggesting acupuncture is beneficial for sleep disturbances, whether it's difficulty falling asleep, staying asleep, having dream-disturbed sleep, or restless sleep. In fact, acupuncture has been shown to yield comparable effects to certain sleep meds, again, but without the side effects. So, and of course, studies also show that, multimodal approach is always ideal. So using acupuncture in combination with CBTI is still kind of the gold standard. Clinically, in practice, we find that most patients do sleep much better after acupuncture, but the effects are a little temporary at first. To really yield those long-term benefits, we really need to see them for regular treatments, either once a week or every other week up front. And then once we get to a good point, we can kind of reduce them down to a maintenance schedule. And then cancer-related fatigue is another extremely debilitating condition, and it can impact health and quality of life during and post-treatment. So looking at several systematic reviews and analyses, there again, consistent evidence that acupuncture can help manage cancer-related fatigue. Again, as with insomnia and some of these other conditions, regular treatments up front and then continuing on a less frequent maintenance schedule later on. Now, clinically speaking, this is another condition that we see the fastest and most durable improvements with. So far, it seems that seeing these patients on a monthly schedule after we can kind of get a few up front is sufficient for them for sustaining adequate energy. One of the patients I've seen the most frequently at BCC so far, can't tell you how excited she was that she was finally able to have energy to take her kids to Disney World for the first time since her diagnosis. So it's really meaningful, hearing this from patients and just seeing them feel like they can live their lives again. And then lymphedema, like leukopenia, is another kind of tricky subject when it comes to considering the safety and efficacy of acupuncture. So most studies indicate that acupuncture can improve cancer-related lymphedema by reducing swelling and alleviating pain and discomfort by needling the affected arm. However, the issue here in practice is whether or not to needle the affected arm where axillary nodes have been removed or a mastectomy has been performed. So as we know, venipuncture is often contraindicated, but there's not really a uniform consensus on acupuncture by any federal agency. So as previously stated, acupuncture needles are much thinner than hypodermic needles, and we take extra measures when it comes to sanitation, but also our technique. But this is an area that here at BCC, we may need to collaborate on to come up with our own best practices, and then again, being sensitive to the wishes of the patient as well. And then finally, looking at acupuncture and overall comfort and quality of life, in addition to the obvious benefit that comes with the reduction of the patient's symptom burden, there are numerous studies that show just positive effects of acupuncture on general health and well-being. And this really goes back to the effect that acupuncture has on the autonomic nervous system and the regulation of various neurotransmitters. So it makes it a great option for patients dealing with depression and anxiety, burnout, or just kind of feeling hopeless and just want a little bit of peace and comfort again. Acupuncture can even be helpful during palliative care, as it's a very flexible therapy that can be easily utilized with a very gentle and comforting technique to support symptom management and comfort. And then some final thoughts on quality of life and just kind of our overall approach to how we're doing acupuncture at BCC. So we've only been here since May, but again, Colby and I have been in practice for about a decade. So in our years of working with cancer survivors in private practice, there are a few things that we hear the most, and then from them have come up with these general approaches to how we work with our patients. So first is, regardless of where they are at in their care, it's always important to ask and listen to what matters to them. And it's really important for our patients to feel like they have an active and empowered role in their care. We offer as much clinical expertise as we can, but we also look to them to tell us what their needs are moment to moment. And for them, having those moments of choice and agency are so important, because when you're going through cancer, there are just so many things that are happening to you and within your body that you don't have a choice over. We're also trying to help them feel just a little bit more at home in their bodies again. We often hear from them that once they begin treatment and once they get their diagnosis, they feel like their body doesn't even belong to them anymore, that it's trying to kill them, or even the life-saving treatments that are provided can feel like they're going to kill them sometimes. So we really try to provide them a safe space to kind of come back into themselves again and feel like it's theirs. It can also be an opportunity to have a moment of mindfulness or presence, to negotiate any thoughts or feelings that are bubbling to the surface. And third is trying to help them find the balance of mindfulness and solace. So when working with patients in the thick of their care, if I ask them about their mental and emotional health, I very often hear something like, I just don't have the energy to dig into my feelings right now, so I'm just telling myself I'm going to unpack this later. And it's in situations like these that we realize that there is some benefit to using dissociation as a coping mechanism, and that forcing mindfulness on people going through an intense trauma can be too much. So in those cases, it's our job to offer them just a quiet space to find solace. And then lastly, is we want to be able to provide a therapy that feels good. So something I heard from a very dear friend of mine who was going through cancer treatments was that while she absolutely loved her care team and all they were doing for her, the fact is that her cancer treatments hurt. The surgery hurts, the chemo radiation hurts. So she was associating pain with the hospital and with the cancer treatment. But when she found that the hospital also offered therapies like acupuncture and massage and the other wonderful things offered down at the resource center, she was able to associate the hospital with again, whole health healing experience to kind of balance out the painful experiences that she was having during her treatments. And it really improved her overall experience with her cancer care. And then the very last thing that acupuncture can be beneficial for during cancer treatment is addressing comorbidities that could be exacerbating cancer or just harming their health in other ways. So very often chronic conditions can take a back seat after a cancer diagnosis, but this doesn't really have to be the case if the facility is offering acupuncture. So let's say I have someone coming in with post-chemo nausea and neuropathy. I can help address that, but then I can also address the chronic stress they're dealing with, or if it's allergies, if it's allergy season, or if they have a migraine, or if they have long-standing IBS. Whatever it is, I can take that whole picture of health into consideration when designing my treatments. So I'm going to close with some final thoughts regarding acupuncture and oncology. So as you can see, in total, acupuncture can be a really valuable supportive therapy during and after cancer care for reducing symptom burden and improving overall health and quality of life. At the end of the day, it's about us as the care team having a very clear vision of our patients' needs and wishes, and then designing treatment plans that reflect that vision. And this really highlights the importance of having acupuncture clinicians in hospital and actively collaborating with the oncology care team. And this is what I mean at the beginning about integrative care that I spoke about at the beginning of the presentation. So now that we're here at BCC, we're very grateful to offer our services to help cancer survivors, both with cancer and non-cancer related conditions, just to help them feel better. Our work is made possible by the Lloyd Family Wellness Resource Center, and we are currently downtown on Mondays and Fridays. So far, the response to our therapies has been overwhelmingly positive in terms of symptom relief and just simply feeling more comforted and balanced. The only speed bump we have to figure out is how to get them on a suitable schedule so we can see them more regularly. So again, if we can try to see people on a weekly basis, that's really what's ideal. So we're looking forward to getting to know all of you and just collaborating so we can offer the best we can to our patients. And that is it. So thank you all. I hope you have questions because I know it's a new and maybe even be a bit of a weird therapy that you've not heard before. Maybe you were a bit skeptical about. So any questions, please lay them on me.